Hey there, Dr. Perry here from Lightbox again. In our last video, we talked about how coronary CTAs have revolutionized the way doctors evaluate patients with chest pain. And I mentioned that new AI technology has the potential to improve that type of scan in a way that can help doctors come up with the best treatment plan for you. But how exactly can AI enhance your CTA? So there are several companies out there that have developed AI software that can improve image quality and reduce the amount of radiation needed for your scan. AI can also help doctors detect and quantify coronary artery plaque, and that kind of technology helps them provide more accurate and consistent interpretations of coronary CT angiograms. But what's even more interesting is that some of this AI-powered software enables doctors to take a detailed look inside the plaque to see what it's made of. But why is that such a big deal? It's because the composition of the plaque often determines how deadly it might be in the future. Terms like lipid-rich necrotic core, intraplaque hemorrhage, and fibrous caps are way beyond the scope of this video. But the important takeaway is that knowing what the plaque is made of can help doctors determine which plaques are more likely to rupture and cause a heart attack in the future. And that information helps doctors make more informed decisions about the best treatment options for you. But there's even more that AI can do. In our last video, I mentioned that before doctors place a stent in the coronary arteries, they often measure something called Fractional Flow Reserve, also known as FFR. Now, I'm not going to bore you with all the technical details about pressure gradients and fluid resistance, but just know that this FFR value basically tells doctors how well blood is flowing through a narrowed artery and whether or not that artery would benefit from being widened by performing a balloon angioplasty and placing a stent. To better understand how FFR evaluates blood flow, think of traffic on a highway. On the left, all those cars are slowing down because the debris on the side of the road is narrowing the highway down to just one lane. On the right, traffic is flowing fast and smooth because all the lanes are wide open. Now, there are definitely more nuances to FFR, but that's the basic premise. So, before AI technology entered the picture, the only way for doctors to measure that important FFR value was by performing a traditional coronary angiogram. But today, there's AI software that can calculate FFR directly from your coronary CT angiogram without needing to stick a catheter in your heart. In other words, a coronary CT angiogram performed with certain types of AI software can give doctors a quick and non-invasive way to see how well blood is flowing through a narrowed coronary artery to determine whether or not that vessel needs to be treated. And some early studies have shown that depending on patient risk factors, coronary CTA enhanced with AI could potentially improve patient outcomes, reduce unnecessary testing, and help doctors better identify which patients would benefit from therapeutic interventions like stent placement. Bottom line is that AI is here to stay, and it has the potential to improve patient care and save lives by redefining how doctors evaluate patients with chest pain. And for that reason, it may be worth asking your doctor if they think your coronary CTA would benefit from this added AI technology. As always, thanks for watching. Keep asking great questions, stay healthy, and we'll see you next time.